The AngE Phlebo is a 2-channel D-PPG LRR device that has 2 infrared sensors to perform venous function measurements. This allows for a fast diagnosis of venous valve incompetence. The AngE Phlebo comes with 2 optical sensors, 500 adhesive rings, a pair of tourniquet cuffs, and a handheld manometer. To start operating the device, simply plug it into the USB port of a computer. The measurement is performed on the seated patient. The patient should sit down for at least 2 minutes in order to achieve a stable circulatory situation. The sensors are placed 10 cm above the inner ankle with double-sided adhesive rings. For hygiene reasons, sensors are always applied with adhesive rings. To apply the double-sided adhesive rings, take one ring off of the roll and apply it to the sensor firmly. Peel off the protective layer. The adhesive rings are for one-time use only and have to be removed after the measurement. Make sure that the sensor position is free of excessive hair and creams. Ensure that the right sensors are used for the right and left leg of the patient. The sensor cable should be directed downwards. The angle between thigh and lower leg should be about 110 degrees, so the leg should be slightly stretched forward. Select the patient or create a new patient in the software and select New Measurement. Follow the on-screen guidance. After the calibration process is completed, the recording of the sensor signal starts automatically. The patient should now operate his muscle pump with 8 powerful dorsal reflections. These pumping movements are optically displayed in the lower right of the screen and accompanied by acoustic signals. In the process, venous blood is pumped out of the venous system. This is followed by a resting period until the end of the measurement, during which the venous recovery is recorded. The AngE Phlebo automatically calculates venous pump volume V0, venous refill time T0 and the half refill time T50. Additional sensors on both probes detect and compare the skin temperature of the patient during the measurement. The results are displayed in a clear color scale. If the first measurement indicates a venous problem, a second measurement with applied tourniquet cuffs can be performed to differentiate between problems of the superficial or deep venous system. To prepare the measurement, you have to connect the hoses with a hand pump. These connectors can simply be plugged in until you hear a clicking noise. At the other end of the hoses, you have to connect the cuffs. The connectors can be plugged together and then twisted until you hear a clicking noise. Apply the cuffs under the knee and inflate them to 80 mm of mercury. This will compress the superficial veins. Repeat the test as indicated on the screen. For the interpretation of the measurement, the pump volume and the refill time are considered. Short refill times and insufficient pump volume indicate venous problems, such as chronic venous insufficiency. The comparison of the measurements with and without tourniquet cuffs helps to evaluate whether the problem is located in the superficial or deep venous system. If the measurement with tourniquet cuffs put on is better than the first measurement without the cuffs, this indicates that the problem is located in the superficial venous system. If the results show no significant difference, the problem is located in the deep venous system. If the result is worse with tourniquet cuffs, the problem is most likely located in the deep venous system, but the superficial veins help the patient to compensate. You can directly print the report or export a PDF document. Optionally, a DICOM or HL7 interface can be configured. The results of the measurement are displayed in a single-page report. It is easy to read and can be configured with your custom logo.